This morning I chaired a meeting of the government's COBRA Emergency Committee on the coronavirus outbreak. The First Ministers of Scotland and Wales and the First Minister and Deputy Minister of Northern Ireland, the Deputy First Minister of Northern Ireland also attended, and we agreed to continue to work closely in the weeks and months ahead. We received a detailed briefing from the Chief Medical Officer and the Chief Scientific Advisor. Again, I repeat my gratitude to both Chris and to Patrick. There have now been 4 deaths from coronavirus in the UK, and our deepest sympathies are obviously with their friends and families. Our action plan, as you know, sets out 4 phases of our approach to tackling the virus: contain, delay, research, and mitigate. We remain in the contain phase of the outbreak, but watching what is happening around the world, our scientists think containment is extremely unlikely to work on its own, and that is why we are making extensive preparations for a move to the delay phase. We're preparing various actions to slow the spread of this disease in order to reduce the strain it places on the NHS. The more we can delay the peak of the spread to the summer, the better the NHS will be able to manage. Patrick and Chris will give you some more detailed information on the latest advice we're giving the public today and how we expect that advice to change as the outbreak develops. As things stand, I'm afraid it bears repeating that the best thing we can all do is wash our hands for 20 seconds with soap and water. We'll also take questions because I know there are lots of things that the public want to hear from our advisors about. But before that, I want to stress the following things. First, we are doing everything we can to combat this outbreak based on the very latest scientific and medical advice. Second, we have a truly brilliant NHS where staff have responded with all the determination, compassion, and skill that makes their service so revered across the world. And they will continue to have this government's full support, my support, in tackling this virus on the front line. Third, we will set out further steps in the days and weeks ahead to help people protect themselves, their family, and in particular, the elderly and vulnerable. Finally, while it's absolutely critical in managing the spread of this virus that we take the right decisions at the right time based on the latest and best evidence. So we mustn't do things which have no or limited medical benefit, nor things which could turn out actually to be counterproductive. There is no hiding from the fact that the coronavirus outbreak will present significant challenges for the UK, just as it does in other countries. But if we continue to look out for one another, to pull together in a united and national effort, I have no doubt that we can and will rise to that challenge. And I'm now going to ask Patrick and then Chris to give their own perspective on where we are. Patrick, over to you.
Thank you very much. Numbers are increasing, and they're increasing across Europe and in the UK. And that increase in numbers is consistent with the fact that there is transmission of this within the community. The number that's particularly important, actually, is the number of people in intensive care, which shows that there are others out there who've had it, and that's come into seriously ill people in some cases who may have infected others before they got to intensive care. So we know that there is community transmission. In terms of the things that could be done to try and suppress the number of people that get this at the peak, push the peak into the summer, and also to protect those that are most vulnerable in society, we need to understand where we are in the epidemic and make sure that we take the actions that need to be taken at the right time. And those possible actions are laid out in the plan. They've all been modelled, and there are others that were looked at that are less effective than the ones that are in the plan as well. They've all been modelled, and we get together and review those numbers through SAGE, looking at the numbers on a daily basis with groups of mathematical modellers, people who understand disease epidemics, clinicians, virologists, other types of scientists with expertise across a range of disciplines. Those different options then can be modelled to give a certain percentage effect on both the peak and the number of potential deaths and the number of potentially very ill people. It's important that no single intervention on its own is enough to make the difference. You have to do things in combination, and you have to do them at the right time. Do it too early, you just end up with the measures not having any effect. So, for example, if you asked everybody with a mild sniffle at the moment to go into isolation, you get a lot of people who haven't got coronavirus, they've got some other circulating illness. In due course, that will change. So that we need to get the measures at the right time so they can be implemented properly and people can actually adhere to them, and it's sensible to make the difference that we're looking for. So those combinations we're going to look at and trigger at the right time in the right combinations to make sure that we have the effect that we're looking for. And that approach of being very driven by the data and very driven by the science is exactly why some of the measures we're taking may look a bit different from some of the decisions that others have made with the outbreak they've got in their country, which might be progressing at a different stage or might have different characteristics.